So next, thinking about what all young people need to know. So I have been quite surprised by the young people coming into the sexual health clinic who don't know the basics of kind of the anatomy of the genitalia. So asking a young person to do a self swab for chlamydia, for example, and not knowing how to do that. So it's really important that all young people know their anatomy, and it's important that we as doctors use the right terms and don't make any assumptions in terms of levels of knowledge. And also that we get used to saying these words without embarrassment, making sure that young people feel comfortable around us. The next thing that I've been surprised by the number of young people coming to clinic being really worried that they've got a sexual infection when actually what they've got is some nasty symptoms related to not looking after their genitalia appropriately. For example, lots of young women coming in with bacterial vaginosis because of overwashing. And again, it's not something that I remember ever being taught about in school growing up. Young men going for long runs, getting testicular pain as a result of not wearing supportive underwear, and again thinking that they've got a sexual infection. So I think if we could teach people the basics of how to look after their genitals in schools, we could potentially avoid a lot of discomfort for young people. Now I'm just going to leave this slide up here, and this is just a reminder really of if you're talking to a young person about how to use condoms, and of course this is the only method of contraception that's going to protect them from sexual infections, knowing how to use it and demonstrating that or providing them with information on how to use it is also key, because with this topic young people may well feel too embarrassed to ask about how to do these things, and so never make assumptions. Like with the anatomy, for example, instructing a young person how to do a self swab, putting on a condom should be explained explicitly to a young person if that's what you're talking about. Next, so emergency contraception. So it was really only recently, and I think just before I started working at the sexual health clinic, that I actually even thought about how emergency contraception works. I think it was a woman's hour program, which definitely shows my age. So emergency contraception works by delaying ovulation. So if a young person has already ovulated or is at the point in their cycle where that's likely to have happened, then your emergency contraceptive pills are not going to work effectively. But there is an alternative. So the copper coil is the most effective method of emergency contraception, and it can also provide long-acting contraception. So if you meet a young person, for example, in the A&E department, who discloses that they've had unprotected sexual intercourse and they're worried about their pregnancy risk, and it's beyond that 72 hours for the emergency contraceptive pill, then they could always consider the copper coil. Now, there are lots of contraceptive choices that are available to young people, and there are also lots of ways that these contraceptives can be taken. For example, in recent months, it has become more typical for sexual health services to recommend that the combined oral contraceptive pill or the progesterone-only pill is taken for for example, a duration of 3 months without a break. And then have a break of just 4 days before restarting the pill up again. Now, this has a lot of benefits, and this might be a benefit to young people that you're seeing in your practice with menorrhagia or difficult symptoms around periods. So it's more effective if it's so the pill is more effective if it's taken in this way, but also you get less symptoms from periods, which is always a benefit. The other picture is of the contraceptive implant, which is also a really effective method of contraception that's potentially a lot more acceptable to young people than things like the Mirena coil. So there's lots of choices with regards to contraception. But if you're starting a young person on an enzyme-inducing drug, then those choices become a lot more limited. So if a young person is on an enzyme-inducing drug, or such as something like rifampicin or one of the anti-epileptics, then the contraceptive implant is not going to be effective. Your contraceptive pill is not going to be effective, and so you've got the choice of it's either going to be an intrauterine system, such as the Mirena coil, a copper coil, or the injection. So when you're starting a young person on an enzyme-inducing drug, it's important to make them aware of the limitations in terms of their choices of contraception. Even if it's not relevant for them right at that time, it may well be relevant in the future. And I'm going to give you some information at the end regarding where to go for lots more information for both yourselves and for young people about contraception, so that you can start that conversation with them, so that they can think about that before going to their GP or sexual health clinic for more information. So now moving on to thinking about sexual infections and their relevance in our practice. So there's just 4 symptoms that you need to think about when it comes to sexually transmitted infections. The first is discharge, so vaginal discharge, penile discharge, and I guess that would be fairly obvious for you all in terms of if you have someone presenting with that symptom, thinking about sexual infections. Dysuria and pain, lower abdominal pain, are both symptoms that we see a lot of in the emergency department, and these can be symptoms of a sexual infection. The next time you see a young person who's presenting with what you think might be a UTI, also have in the back of your mind, could this be a sexual infection? Similarly, if you're seeing a young person presenting with lower abdominal pain, maybe they're a query appendicitis, something like that, also think about the possibility of a pelvic inflammatory disease. And the final symptom is bleeding. So postcoital and intermenstrual bleeding can also be a common symptom of sexual infections. So once you've got one of those symptoms and you want to ask a little more, you can remember the 5 P's for a sexual history. So that's partners, practices, past history of sexually transmitted infections, what protection are they using, and what are their pregnancy plans. Just a little reminder of those things that are important in terms of thinking about sexual history. Because sexual infections are common, so chlamydia is the most common sexual infection, and followed by genital warts, then gonorrhea, and genital herpes. And the highest risk of a new sexual infection is in 15 to 24-year-olds. So it's really important that we have this as that we have sexual infections in our mind when we're seeing young people. And when we and although HIV and syphilis are not up here in terms of the most common sexual infections, they can obviously have huge consequences. So when we've got a young person who's had unprotected sexual intercourse, we always recommend at the sexual health clinic testing for HIV and syphilis as well. But there are also some other STIs that I'd never ever heard of. The one on the left is Trichomonas vaginalis, which is a protozoan parasite that's passed through vaginal sexual intercourse. And then you've got Mycobacterium genitalium, which is a bacteria that can be quite tricky to treat, requiring longer courses of antibiotics, for example. Now, again, you're paediatricians. You don't need to be experts in sexual infections, and certainly not in the less common ones. But just having an awareness that these things exist. So if a young person comes to you, you can speak with a little bit of knowledge there is a good idea. Okay. So now I'm going to move on to talk about some more general points and practice points that I think could potentially be relevant for all of our interactions with young people, not just related to sexual health. So at the at the sexual health clinic, confidentiality is routinely explained to young people who come to the clinic. And routinely the young person, even if they come with their mum, is asked to come into the room on their own in the first instance, and then the parent or friend or whoever they've come with can be brought in at the end if that's what the young person wants. But by explaining confidentiality and its limits clearly and effectively, we can make sure that the young person feels respected and feels safe to share some of the more intimate details of their life. So I think that this is something in paediatrics that potentially we don't do enough of, and so I think that since seeing how the team work at the sexual health clinic, I've definitely had it much more in my mind. So I wanted to bring that to you today. So the sexual health clinic works really hard to be very inclusive of all gender identities and sexual orientations, and they do this in a number of ways. So the waiting room has relevant posters on the wall. The staff will have their rainbow lanyards or rainbow badges, and there's no assumptions made. So you're asked when you go to the sexual health clinic what your gender identity is, what your sexual orientation is, and I think that this complete lack of making assumptions using kind of heteronormative languages in this setting really does a good job to help LGBTQ+ young people feel more comfortable in the setting. In addition, they also have the support of an excellent third sector organisation who come along to the young people's clinic to provide support to LGBTQ+ young people who present to the clinic, and can plug them into some of their youth groups and other support services that might be relevant. So I think when we're taught about communication skills, there's a real focus on active listening and on eye contact. But actually, I think that that we can also think about how we can use eye contact in a different way. So at the sexual health clinic, I've seen a lot of the practitioners will look away when and look at their computer screen and go through that form that's there in front of them when they're taking those more intimate details of the sexual history, and this kind of sort of, I guess, checkbox sort of approach helps the young person to feel like they're not, no one's looking at them and making assumptions, asking them these questions because of how they look, how they behave, because they've come to the sexual health clinic. It just becomes routine, and I think this can be a useful tool to make sure that that young people are aware that they're not being singled out in any way when we're asking them these more detailed questions. And now coming on to safety. So at the sexual health clinic, all young people who present are routinely screened for child sexual exploitation, and this is using the Brook CSE tool, which I'm going to provide a link to at the end. So this tool essentially it runs through a heads assessment that you're going to find out more about later in the week, but focusing on those kind of indicators that may indicate that a young person is either being sexually exploited or at risk of sexual exploitation. And actually the young people don't seem to mind these questions and this screening being done, because it's done in a thoughtful and sensitive way, so that the young person knows that actually the practitioner there is really looking out for their safety. Included within this is the practitioner talking through with young people the risks of sexting and of sharing explicit images, just to remind them of really the gravity of doing that, and providing them with relevant support if that comes up as an issue for them. But ultimately, I think as paediatricians, we may not always feel so comfortable asking questions of young people in this way, but I think practice makes perfect, and the more comfortable that we can feel with getting used to talking about these things with young people, the more comfortable that they will be, and the more able they will be to share those details with us, so that we can ensure that they get the right treatment, that they feel safe, and that they come back if they have more problems in the future. So my take-home messages for you today are to offer to see young people alone, make sure that they know that the conversations with doctors are confidential, and where the limits of that confidentiality is. When you're thinking about starting a medication that's going to interact with a contraception, have a basic understanding of of contraception choices, and those which they would be excluded from if you're starting a particular drug. I wouldn't expect anyone to have full understanding of all the contraceptive choices. But if you can start that conversation and give that young person information, then it means that when they go to the sexual health clinic, that they will be able to have had some time to reflect upon their choices before going down a particular path. Thirdly, we thought about those symptoms of STIs, and particularly I think the ones where we can often kind of go down, because there's so many other differentials that we're much more used to seeing, we can often forget about sexual infections. So dysuria and abdo pain. If you see those things, if you have those symptoms in a young person, do think about sexual infections as a possibility, and ask the appropriate questions. And when you see a young person who is sexually active, particularly think about safety. And if you're feeling a little bit unsure about this, then I would recommend just printing off the Brooke Child Sexual Exploitation pro forma that I'm going to give you a link to at the end, and just running through those questions with the young person as a really good way just to make sure that you've got a good picture of their level of risk, and then you can act accordingly. So I'm going to run through some of these resources, and then if you've got any questions, if you just pop them in the chat bar, I can see one there that I'll talk through in a second.
Yeah, you know.
Oh. But I'll run through the resources first, and then I'll answer any questions. So just to give you a little bit of time to pop those questions in the chat, and then we're going to finish off with a video. So if you need to know any information about contraception for your patients, then it's this website, the Faculty of Sexual and Reproductive Health, and what you will find there is the Contraception Bible. So it's got everything on that in terms of thinking about contraindications to contraception, interactions, potential side effects. So a really good resource that you can use if you need to have conversations about contraception with a young person, particularly if you're having to deal with something tricky like interactions. In terms of sexual health guidelines, the British Association for Sexual Health has got guidelines for treating all of your sexually transmitted infections, including some of those rare ones that I mentioned, so Trichomonas vaginalis and MGen and Mycobacterium genitalium. The Brooke CSE tool is an excellent tool for screening young people for risks of sexual exploitation. And it goes through in a kind of head sort of format from the kind of more general questions down to the more sort of specific questions, allowing you to build up a rapport whilst you do that tool, and just really to get an insight into that young person's life. So I mentioned a little bit about my own experience of relationship and sex educations, and I think the good news is that in terms of kind of relationship and sex education in schools now, it is compulsory, which it wasn't before. But actually, there's quite a lot of barriers to young people getting really good sex education in school, and a lot of that is around kind of the teachers having the right training and the right support to be able to deliver a really high quality relationship and sex education. If you're interested and you want to find out more, then there's some podcasts called the Sex Ed Diaries that are by Brooke, and this is a really good just to kind of to get you up to speed with what young people's experiences are now, because they may be very different from your own. And then finally, a couple of other things. So the NHS Go app is going to give young people lots of information, but also things like where to go to get morning after pill, for example. And then Sexwise from the Family Planning Association has got lots of information there as well. So I'm just going to go through some of the questions that I've got, and then we'll finish off with a video, and then you're all done. So the first question was, how did I get a placement in a sexual health clinic? So this year I'm out of programme. It's an OOP-E/OOP-T, and my job title is I'm a clinical fellow in young people's health. Basically I'm doing the on-calls on a general paediatric rota, but then I've got quite a lot of space within my 9 to 5 to develop my interest in young people's health and complete my spin training. And so really it was kind of because of this kind of element of freedom, so to speak, I was able to build up a link with a sexual health clinic, and then I kind of completed their induction, and we made a plan for me to go to their young people's clinic. So I think that was kind of how I did that. I think the barriers for other people, particularly within training, would potentially be just getting that regular time slot. But yeah, that's how I did it. And they and the sexual health team that I worked with was so friendly and so helpful, and they were really used to having junior doctors who didn't know a great deal about sexual health and really getting them up to speed on things. So they were used to having kind of F1s, F2s, and GP trainees. Lovely. So hopefully that answers that question. I can give you the links in the chat, absolutely, and I'll also upload this presentation to the London School of Paediatrics website, so that you've got all those bits and bobs. Some transitional age patients that could benefit from this information. Potentially. So the question is, we have some transitional age patients that could benefit from this information. Would you be interested in doing an online session for them? Definitely contact me. I'd be definitely interested in finding out more about that, for sure. So my email address is on the London School of Paediatrics timetable there. Useful openers for starting the discussion about anatomy. So I don't really have any useful kind of openers as such, but what I would say is that if you can make no assumptions and probably use diagrams in terms of thinking about anatomy, I think assuming that they don't know anything is a good start. Is a good starting point, and might be quite helpful. And using diagrams or models would be a good idea. You will get a lot more tips about this, because this is something the Brooke Relationship and Sex Education team are really passionate about on the Sex Ed Diaries as well. Any good resources for talking about sexual health with younger children? So I don't have any that I've personally used, but again, I would point you in the direction of the Brooke website, because they have a lot of different tools there that you might be able to use. Cool. Perfect. And then how can I talk to a teenager about STI and give advice for epileptic patients regarding safe sex? So I would say, how can I talk to a teenager about sexual infections and give advice for epileptic patients regarding safe sex is the final question there, and I would say that make sure that you're up to date in terms of you've done this talk, you've listened to this talk, but have a read of some of those resources there. But you can also signpost young people to relevant websites such as the Sexwise Family Planning Association website. So ensuring that the young person knows about the risk of sexual infection, and pointing them in the direction of knowing more about that, which would be the Sexwise website. And then if they want to take that conversation further, making sure they know about the sexual health clinics in their area. So that's the steps I would take. So make sure that you're fully informed. Make sure that you know about websites that the young person can use to get accurate information, and knowing your local sexual health service where the young person can go for more advice. So I think that is everything for now. So I'll copy these bits and bobs into the chat bar, but I'd be so grateful if you could fill in feedback, the feedback form that I'll also put a link to there. So I hope that was helpful. So links I can copy that into the chat bar now, but I'm also going to copy the feedback link, and I'd be really grateful if you'd be able to fill that in for me. Thank you.